Colon cancer is treated initially by very thorough assessment, and the assessment consists of biopsy diagnosis and assessment of how the cancer has spread locally and if there's any evidence of it spreading to other parts of the body. And the way that we do that is normally with imaging, with scans, which are CT scans and sometimes PET scans, and with rectal cancer we use MRI scanning as well. So having assessed the cancer, the treatment is then tailored to the individual patient, and this can be quite varied. So there are some patients who go straight for an operation to take out the affected section of colon, often with the opportunity of potentially curing the patient. And then there are other situations where we feel that we should give the patient neoadjuvant treatment, which we mean treatment prior to any surgical intervention, and that can take the form of chemotherapy, or with rectal cancer in particular, with radiotherapy that is given to shrink the cancer and make it more amenable to cure by surgery. In fact, in today's world, there are some opportunities now to treat cancers completely with neoadjuvant chemotherapy, but this is currently under investigation. So our ability to manage and treat colon and rectal cancer is improving quite rapidly at the moment. The standard treatment is surgery or preoperative treatment with neoadjuvant chemotherapy or radiotherapy followed by surgery. The short answer is that with today's treatment, we often use surgery to remove the affected section of either colon or the rectum to try and cure or palliate the patient. So it does depend a lot on the individual circumstances, and each patient needs tailored care. But if the tumours are early, surgery is curative and is often used. But if the tumours are late, and sometimes we like to give treatments such as chemotherapy or radiotherapy to shrink the tumour and make it more amenable to successful surgical excision. So the answer is, at the moment, surgery is one of the main tools that we have for treating colon and rectal cancer. That very much depends on the situation for the individual patient. So with early colon or rectal cancer, surgery can be curative, but with later presentations with more advanced disease, surgery can be used to help the patient, but maybe not always be curative. So that's very dependent on the particular situation of the patient when they present with their cancer. Absolutely. So there are many patients who are completely cured of their colorectal cancer with either surgery or surgery combined with other treatments such as chemotherapy, and they live a long and healthy life. They do require follow-up. So patients who have had a diagnosis of colorectal cancer need to have regular checkups with blood tests and imaging and endoscopy or colonoscopy to ensure that the cancer has not returned in any way. Sadly, there are cases that present with advanced disease or who have disease that is resistant to treatment who cannot have a long life, but we do our best to make their lives as healthy and fruitful as possible. So the answer is many patients with colon or rectal cancer can lead a perfectly normal and healthy life, but unfortunately there are a few in whom it is beyond our current ability to help them. There are families who have high risk of colorectal cancer because they have an underlying genetic predisposition, and the extreme example is familial polyposis coli, where these families have hundreds and hundreds of polyps in the colon and a very high risk of developing colorectal cancer unless they have treatment. Other than that, there are conditions which predispose to colorectal cancer. So, for instance, very long-standing ulcerative colitis in a patient who has the disease affecting the entire colon does increase the risk of colorectal cancer, and those patients will be counselled and checked regularly to make sure that they are safe from this regard. In the general population, the risk of colorectal cancer increases with age, though recently we have noticed younger patients coming through with colorectal cancer than we had seen previously. So age is a very important factor. So in summary, the main risks are an underlying genetic predisposition, some inflammatory diseases that affect the colon, and increasing age.